You can have this later. Okay, so let's start with a brief introduction on medical ethics. This is your skill enhancement course. So this is basically, it will be used in your professional realms. Basically, when you start your professions, this is something which is indispensable to uh, all professions, especially science professions, where you will be dealing with either the environment or with human beings. So, firstly, the basics. Let's see what the objectives are. The main objective of medical ethics is to provide ethical understandings to students in the field of medicine and clinical practices. Now, we need to know what ethics are, and then what we can do is only after that can we understand medical ethics. So, ethics is a branch of philosophy. Ethics, firstly, there is the conventional meaning of ethics. Conventional meaning of ethics is this what is right and what is wrong. Morality. Ethics is morality. That's the conventional meaning. जो हम आपस में अपनी रोजमर्रा जिंदगी में in the English language we use ethics. We use it in our regular conversations. मगर जब ethics की बात होती है, when it comes to philosophy, you're not studying conventional connotation of ethics, you're studying a discipline called ethics. That requires a definition. एक काम आप करेंगे, अगर आपको कोई सवाल पूछना होगा, any question, anything, you can write it in the WhatsApp group. ठीक है? So you can do that. I'll see that either after the class or later. Any question, anything that you need to ask, you can write it in the WhatsApp group. So ethics जो है as a discipline, not as conventional usage that we have in the English language. Ethics in the the professional terms or in academia is a discipline. It's a subject under philosophy. So ethics deals with the right or the wrong action in a particular circumstance by raising the question of what should one do. So this is what is studied basically in this field कि सही क्या है और गलत क्या है. हम सही किस तरह समझते हैं और गलत किस तरह समझते हैं. हमारा स्टैंडर्ड क्या है समझने क्या सही और गलत. वो सब पढ़ा जाता है in the field or the subject of ethics, which is a branch of philosophy. So for example, let's say you get a question in your exams, write a detailed essay on medical ethics or characteristics of medical ethics. First, you'll have to define what ethics are. So ethics is a subject in philosophy that studies morality. I really suggest that you should take your notebook and you should start taking notes. Okay, I'm going to, anyways, this document is with you. It'll be nice if you save it or print it. So you can prepare for your exams from this as well. And notes भी आप लेंगे, उससे याद भी रहता है, अच्छी तरह से समझ भी आता है. तो ethics जो है, it deals with the right or the wrong action in a particular circumstance by raising the question of what should one do. ये आप, this is a definition that you can use of ethics. Or you can say ethics is a branch of philosophy that studies morality or moral actions and other things that are related to that. For example, the standards of morality or the criteria to judge morality. किस तरह हम जज करते हैं मॉरल एक्शन क्या है, करेक्ट एक्शन क्या है और रॉन्ग एक्शन क्या है, वो सब पढ़ा जाता है एथिक्स में. ठीक है? So ethics is a branch of philosophy that studies with right and wrong actions in particular circumstances, or it studies with morality, human morality, the right and wrong. These are basic definitions of ethics. But हमारा ethics subject नहीं है, हमारा medical ethics subject है. So easily from the word itself, we can understand that this will be the sub-discipline. This will be a discipline under ethics, a sub-discipline of ethics that helps us to understand what are the right decisions or choices within the field of medicine. So आप बोलेंगे medical ethics is a sub-discipline. Medical ethics is a sub-discipline of ethics that studies that studies the right and wrong, that studies the right and wrong related to the field of medicine. The right and wrong related to the field of medicine. Okay, I can give you another definition as well, जो मैंने पहले भी क्लास में दी थी. आई थिंक मैंने आपकी एक दो क्लासेस ली थी, उसमें हमने बात किया था. And we define medical ethics as examining a specific problem. Examining a specific problem. So medical ethics, what does medical ethics do? It examines a specific problem. It's usually a clinical case. Okay, it's usually a clinical case. क्योंकि हम medical ethics की बात करें ना, तो कुछ clinical case होगा, या तो patient involved होगा, या तो कोई drug या medicine involved होगी. तो medical ethics involves examining a specific problem, usually a clinical case, and using values, facts, and logic. Using values, facts, and logic to decide to decide what is the best course of action. To decide what is the best course of action that should be adopted. That should be adopted. So I'll repeat that again. Medical ethics involves examining a specific problem, examining a specific problem, usually a clinical case, and using values, facts, and logic. Using values, facts, and logic to decide what is the best course of action, to decide what is the best course of action that should be adopted. That should be adopted. Let's see this. Do I have a whiteboard? Okay, good. So that gives us a little bit of introduction into medical ethics. कि हमने बोला कि medical ethics जो है एक specific problem को examine करता है. कोई भी specific problem, मगर it should be a clinical case, क्योंकि हम medical ethics की बात कर रहे हैं, है ना? हम regular ethics की बात नहीं कर रहे हैं, medical. So it has to be a clinical case, usually involving आप समझे या तो patient होगा, या तो उसके साथ किस तरह deal करना है, या तो कोई मेडिसिन या ड्रग के इफेक्ट्स क्या होंगे, या तो एनिमल टेस्टिंग के बारे में होगा, या तो ऑल ऑफ दीज थिंग्स जो मेडिसिन में बड़े बड़े इश्यूज है. फिर उसमें क्या है? वी यूज थ्री थिंग्स. वी यूज वैल्यूज, फैक्ट्स एंड लॉजिक. ये तीन चीजें फिर यूज होती हैं टू एग्जामिन दिस प्रॉब्लम. एक तो वैल्यूज कि मतलब हमारे वैल्यूज, व्हाट आर वैल्यूज? वैल्यूज आर आवर अंडरस्टैंडिंग ऑफ व्हाट इज राइट एंड व्हाट इज रॉन्ग. वैल्यू से ही हम समझते हैं क्या सही है क्या गलत है, राइट? और फैक्ट्स पहले हमें वी हैव टू बी क्लियर विद द फैक्ट्स कि व्हाट आर द फैक्ट्स ऑन द ग्राउंड. लेट्स से आई गिव यू एन एग्जांपल. एक केस है मेरे पास, लेट्स से अबॉर्शन का केस. देयर इज अ वुमन who is pregnant, and जो baby है, she has to undergo an abortion if there are multiple factors in it कि हमें समझना है किसको ज्यादा harm हो सकती है. अगर baby will be born, will the mother die? Or if the baby is aborted, will the mother be saved? If the baby is born, will both of them be okay? तो ऐसे जो ये कॉम्प्लिकेटेड मसले होते हैं, उस वक्त मेडिकल एथिक्स यूज होते हैं. उस वक्त फिर वैल्यूज इस्तेमाल होते हैं, फैक्ट्स इस्तेमाल होते हैं कि पहले फैक्ट्स ऑन द ग्राउंड बोलो, किससे सबसे ज्यादा हम बेनिफिट कर सकते हैं, किसकी लाइफ यहाँ बचानी सबसे ज्यादा जरूरी है, और क्या चीज सबसे सही होगी यहाँ करनी. वो मेडिकल एथिक्स. डिस्कस करती है, राइट? तो फैक्ट्स शुड बी क्लियर, वैल्यूज से हम जज करेंगे, और थर्ड वाला है लॉजिक. Obviously, we will use our logic. We will use our logic to understand what is the right thing to do. We will use reason. अपनी अक्ल को इस्तेमाल करेंगे कि इधर क्या सबसे सही है, जिससे हम मैक्सिमम बेनिफिट दे सकते हैं माँ को भी और बच्चे को भी. वो सोचना जरूरी है. सो ये चीजें बाकी बाकी चीजों में भी यूज होगी. फॉर एग्जाम्पल, इन द केस ऑफ, आप पढ़ेंगे यूथनेशिया, कि कोई ऐसा पेशेंट है who is in the vegetative state, who is in a complete vegetative state. क्या उसका लाइफ सपोर्ट जो है वो हटाना सही है या उसको रखना सही है? किस में ज्यादा बेहतरी है? इज ही और शी इन पेन, और इज ही और शी नॉट इन पेन? Is it beneficial for the family? Is it not beneficial for the family? So all of these ethical matters are discussed and understood within medical ethics. And all of these have to be understood via three things. You have to have your values, your facts, and logic to examine these specific cases. See? So, moving on. अच्छा, इसमें ये this concept of otherness is very important in ethics, क्योंकि we are always dealing with an other. In ethics, we are always dealing with the other. या तो वो animal होगा, या तो कोई patient होगा, या तो environment होगी, या तो कोई किस्म का ethical issue जब भी होता है, you are always dealing with the other person. So this concept of otherness is central to ethics. That's why then we have the questions of right and wrong. Okay, now let's go directly into the introduction. Medical ethics is a branch of applied ethics that deals with practical issues within the area of medicine and clinical practices. So this is a good definition that you can have. Medical research and clinical practices are integrated with ethics. क्योंकि मतलब आप समझे, मेडिकल रिसर्च जो है और क्लिनिकल प्रैक्टिसेस, how can they function without ethics? Because you're only dealing with the other, you're only dealing with human beings, and human relation में ethics will always come. Ethics will always be there. आप, for example, psychology पढ़ रहे हैं, आपका maybe some of you may have a psychology major, or maybe you may study zoology. So even when you'll be dealing with a patient, or you will be dealing with, let's say, even animal research and things like that, you are dealing with the other, and their ethics will inevitably, without a doubt, ethics आ जाते हैं उसमें. ठीक है? So medical ethics is an important branch of medicine and clinical practices, as ethics plays a vital role in our day-to-day life. Every human being lives their life with their own choices and decisions. One always acts according to one's own choices and decisions. There is an interconnection between one's acts and choices. Ethics starts when human beings make choices and decisions to act. मतलब हम हमेशा we are making choices and decisions all our life. मगर अब ethics का question तब आएगा जब हम action, जब हम we start acting on our choices and our decisions. कि मैंने जब कुछ एक्शन लिया अपने चॉइस पे या डिसीजन पे, उससे किसी को फायदा पहुंचा या किसी को नुकसान पहुंचा. That is the question of ethics, right? So it deals with choices. Ethics deals with choices. Where there are no choices, there is no role of ethics. Agar choices hi nahi hoti, let's say we had no choice and we had no free will, there would be no ethics. Because we are all free and we are constantly making choices, we are constantly making decisions. That's why we have ethics. So there's some common questions that everybody thinks about, such as how can I live a good life? What is a way to live a good life? In a similar manner, medical ethics is a practical subject. It's also a branch of moral philosophy. Moral philosophy ही हुई ethics. ठीक है? So it's a practical subject. यहाँ आप सीखते हैं practical life किस तरह होनी चाहिए. Ethics is an integral part of medical ethics. It deals with those choices and decisions that are considered to act in the everyday medical practices. So this is just basic stuff. You can go through this. Extremely easy, inshallah. So important approaches in medical ethics. Ab approaches mein hum, let's go briefly into the approaches. to medical ethics. Acha, this is, no, wait, let's not go here. I want you to, this is more important. This is more important. Let's not go to the approaches because I'll have to check your syllabus उसमें approaches है या नहीं. मगर this is important. ये आप लिखेंगे, ये मैंने पहले भी वैसे पढ़ाया था जिनको मैंने क्लासेस पहले ली थी. ये जो चार चीजें हैं, चार these principles. These are 4 principles. You can write the 4 principles used in medical ethics. 4 है ये. Okay, there are 4 principles used. Principles भी बोल सकते हैं, moral values भी बोल सकते हैं, but there are 4 in number that are extremely important for you to understand medical ethics. 4 principles that are utilized or used in medical ethics, or 4 moral values. ठीक है? Let's go through this quickly. The ethical and moral problem in medical ethics is generally analyzed and resolved on the basis of these 4 problems. तो जो भी problems है medical ethics में, उनको analyze किया जाता है using these 4 principles. जो भी प्रॉब्लम है, आप समझे abortion है या surrogacy है. Surrogacy is when a woman wants a baby, when a couple, let's say, they want a baby, they cannot have a child, or for example they don't want to have a normal pregnancy. What they do is they ask somebody else, or they pay somebody else to have their child. So it's almost like you are renting a womb. That's called surrogacy. And there are other ethical issues as well, which are euthanasia. Euthanasia, which is a patient is on life support. क्या उसका life support हटाना ठीक होगा, ethical होगा या नहीं होगा? अगर लाइफ सपोर्ट हटाएंगे तो ऑब्वियसली वो तो मर जाएगा, मगर लाइफ सपोर्ट के साथ भी वो एक ऑलमोस्ट डेड कंडीशन में है. तो ये चीजें, these are the problems in medical ethics. मगर इन problems को डील करने के लिए 4 principles और 4 moral values यूज होते हैं, और वो हम अभी पढ़ेंगे. अच्छा, what are those 4 values and 4 moral values or 4 principles? These. Number 1 is autonomy. Number 1 is autonomy. Number 2 is beneficence. Number 2 is beneficence. Number 3 is maleficence, or actually it is supposed to be non-maleficence. Non-maleficence here. And number 4 is justice. Number 4 is justice. So you'll have to remember these 4. These are the 4 principles used in medical ethics: autonomy, beneficence, non-maleficence. Yahan non hai, they've missed that. Non-maleficence and justice. अब ये क्या है? So इसमें थोड़ा सा just a brief introduction. ये 4 principles, they play an important role to make one rationally and ethically aware about the clinical research and medicine. तो इससे क्या होगा? One can make a rational and ethical decision, and one can have an awareness about the research that is the problem. That is the problem that we are examining under medical ethics. In this context, these people, they have claimed that no one principle can be important without the other. So there are many ethicists, people who study medical ethics or ethics in general will be called ethicists, or people who study in particular medical ethics or bioethics. Bioethics होगा full biological research पे, तो zoology है, और या botany है, या जो भी life based research होगी, that will be called biomedical research, and uske ethics will be called bioethics. So people say, these bioethicists and ethicists, they say that there's no one principle that can be important without the other. मतलब ये नहीं बोल सकते हैं एक ही हम इस्तेमाल करेंगे बाकी नहीं करेंगे. ये चारों related है. They are equally important. These 4 are equally important. So number 1 is autonomy. Autonomy is एक किस्म का freedom, एक किस्म का independence or independent control over oneself. The term autonomy is derived from 2 terms: auto, ऑटोमेटिक जैसे यूज होता है ना, ऑटोमेटिक का मीनिंग क्या होता है? विच इज सेल्फ run. Automatic is any machine which is self run. So auto is from a Greek word which means self, khudi se, and nomos which means rule. So it means self rule. Autonomy is self rule. अपने आप पे काबू और इख्तियार रखना, अपने आप पे इख्तियार होना. To be autonomous means an individual has the freedom to decide or choose about one's personal life. So, for example, all of us are autonomous. We have some bit of autonomy, that we do have freedom to choose and decide about our personal life, right? Autonomy is a very important value in medical domain because it is a person or patient's freedom to decide what to do with their life or how he or she wants to live. For example, a patient is free to make decision about her life without external influences. But the opposite side can be possible. What about those patients who don't have the rational capacity to take their own decisions for their own life? In this case, they cannot make autonomous decisions, but they will be treated to their best interests. Matlab, we all have our autonomy. We all make our own decisions about our life to a certain extent. We're not talking about, all, nobody has full autonomy, obviously, but we are all considered independent people, especially the older we get, the more responsible we get, we have autonomy. मगर अब ये क्या है, और जो ये principle of autonomy है, that is the most important medical ethics, कि जो ethicists हैं और जो medical practitioners हैं, they should know कि जो patient जिसके साथ ये deal कर रहे हैं, वो एक independent और autonomous person है, कि मतलब वो अपने decisions खुद बनाएगा या बनाएगी. Why is that important? I gave an example in the class. For those of you who had come, you will remember. Let's say you are a psychologist and you have a patient who has a disorder. और आपको पता है ये डिसऑर्डर कैसे ठीक होगा. आपको मे भी पता है इसमें ड्रग्स क्या इस्तेमाल होंगे, थेरेपी भी क्या इस्तेमाल होगी. सब कुछ आपको पता है और ये भी पता है अगर ये अच्छी तरह से हो जाएगा, ये पेशेंट बिल्कुल ठीक हो जाएगा. Magar, can you force the patient to take that therapy and to take that medicine, even though you know that this therapy and that medicine is going to cure the patient? You cannot force. You cannot force the patient to do that. That is because the patient has his or her own autonomy. They are autonomous persons. They make their own decisions. At the most, that the doctor or the medical practitioner or the psychologist, what they can do is at the most, they can give the best advice. They can give the best consultancy. They can say to the patient, देखिए आपको ये disorder है, this is the therapy, this is the treatment. I can give this to you and you will be perfectly fine. If you take this, whatever. So that is the most that you can do. You cannot decide for them. You cannot force them to take this. Why? Because you have to recognize that the patient and every human being has their own autonomy. You cannot force them. Magar, now let's say, the इसीलिए ये एक मसला है क्योंकि there can be patients who don't have the rational capacity to take their own decisions. But there can be patients who, let's say, have no family. And let's say they are completely independent and they don't have the rational capacity also. मतलब वो सोच भी नहीं अपने लिए सकते हैं अच्छी तरह से. Maybe वो young हैं, बच्चे हैं. Maybe उनको कोई mental किस्म की issues हैं, because of which they cannot reason well. What do you do in that case? What do you do in that case? उस वक्त you will use this concept of autonomy in the sense you will decide for them as if you are them. You will decide in their best interests without harming them. You will decide, you will take their decision for themselves, but for their best interests. वो आपको सोचना है. So in the simple term, it is said that the patient's consent is must if the patient is able to make a rational choice or decision for his or her own life. तो पेशेंट की कंसेंट जो है दैट इज एन एब्सोल्यूट मस्ट. अगर आपने देखा होगा whenever we go to a hospital, अगर कुछ ऐसा कोई सीरियस प्रोसीजर होता है वो पहले साइन कराते हैं, this is at your risk and you are taking full responsibility अगर प्रोसीजर थोड़ा सा ये कॉम्प्लिकेटेड होता है. Why do they do that? Because they want to give you the consent. इख्तियार पेशेंट के पास होना चाहिए या पेशेंट की फैमिली के पास होना चाहिए. They should be making the decision. The doctors or the hospital cannot make that decision for them. So this is an extremely important principle in medical ethics, which is autonomy. Moving on. Beneficence. Beneficence obviously is from the word benefit. हम बोलते हैं ना benefit. मतलब किसी चीज किसी को फायदा पहुंचाना, किसी के लिए खैर करना, to do something good. Welfare, to focus on somebody's welfare or well-being. This is beneficence. Now, the purpose of this principle in medical ethics is to serve the best interests for others. As you are a scientist, let's say you are making a drug, a medicine to cure some disease. And you're a scientist, you're a pharmacologist, you know how to make medicines, but आपके लिए most important cheese hai that you understand that this drug that you are making, it should be for the welfare and the well-being of others. Welfare and the well-being of others. For instance, a doctor should act in a manner that action will promote the well-being of a patient. It should be for the benefit of the patient. In this context, these people, they claim that there are two kinds of beneficence: positive beneficence and utility, which means to promote benefits in the interest of others. Utility means to weigh the benefits and harms in the interest of others. If the degree of benefit is more than the harm, then this principle is applicable. Thus, it is the core value of medical ethics. मतलब दो चीजें हैं, beneficence है और utility है. तो आपका मेन फोकस होना चाहिए to bring welfare and well-being to the patient, to the person who is under your care. And many a times you will have, let's say, a treatment जिसमें harm भी है. Let's say you're a psychologist and you are treating your patients, और मगर जो आप थेरेपी दे रहे हैं उसमें थोड़ा सा harm भी हो सकता है पेशेंट को, उसमें कुछ परसेंटेज ऑफ साइड इफेक्ट्स भी है. उस वक्त क्या आप करेंगे? नाउ यू वांट टू डू द बेस्ट फॉर द पेशेंट. नाउ यू विल वे द गुड एंड द बैड, द बेनिफिट एंड द हार्म. सो आप उसकी यूटिलिटी देखेंगे. यहाँ ये यूटिलिटी का भी कॉन्सेप्ट यूज होगा कि क्या सही है करना. क्या इसका if the benefits are more than the harm, then we'll go ahead with it. If the harms are more than the benefit, then we won't go ahead with it. But obviously it has to be done with the consent of the patient because autonomy है ना. तो ये beneficence भी आ गया, which is very simple, that it is the welfare and the well-being of others. As a medical practitioner of any sort, this should be your priority. Number 3, non-maleficence. Non-maleficence. अब ये है opposite of beneficence, right? Maleficence is harm. मगर क्योंकि non है, that means you will not do any harm. You will not do any harm. You should be, as a medical practitioner or any sort of scientist who is going to be dealing with human lives or any kind of life, it should be very well understood that scientific research should not cause harm to the environment or to living beings of any kind. So in simple terms, the meaning of this value can be understood that an action should be done in this manner. If it cannot promote the well-beings of others, then that action should not harm for others, should not cause harm for others as well. But let's say there is an action, कोई किस्म का procedure है, अगर ये well-being ना नहीं कर रहा है, मतलब बिल्कुल भी, मतलब there is no benefit in it, at least you should absolutely make sure कि इससे harm कम से कम ना हो. Neutral is the minimum that you can do. Harm भी बिल्कुल नहीं होनी चाहिए. So this should be, and this is an important principle in medical ethics, that firstly your priority should be to bring benefit. If you can't bring benefit, at least you should prioritize that there should be no harm. Absolutely no harm. So for example, let me give you an example. बहुत सारी medical research होती है, जैसे drug बनाया कोई किसी बड़ी pharmaceutical company ने कोई किस्म का drug बनाया, or now they want to see how effective it is and what are the side effects. There are many cases of very big influential companies that have done human testing. ऐसे ही गरीब लोगों पे विदाउट देयर नॉलेज, विदाउट देयर कंसेंट, उनको ये हार्मफुल ड्रग खिलाया. बहुत केसेस ऐसे हैं, आप हिस्ट्री में पढ़ सकते हैं, इंटरनेट पे लिखा हुआ है. बड़ी बड़ी कंपनीज जिनने फिर बच्चों को मारा, बहुत सारे बच्चे मर गए इसकी इस यू नो मैल प्रैक्टिस की वजह से. That is maleficence, that they harmed the people, and their medical research did not bring benefit, it harmed. Right? So the least that you can do is at least you can make sure कि इससे harm नहीं होना चाहिए. So that is very important. Non-maleficence is not to do any harm. Maleficence means harm. So यहाँ example, a doctor should treat his patient with the intention of not harming his patient. A doctor should understand the risks and benefits in the case of the patient's treatment. Benefits should outweigh the risks. You are in control of a life. Tomorrow you're going to be in control of somebody's mind. You're going to be in control of maybe a part of the environment. You're going to have control over, let's say, some animals in animal research. Maybe some, other forms of life like plants and trees. At that time, you will understand that these principles are absolutely important. There should be no harm done to the environment. There should be only benefit that should be done. If, let's say, you can't guarantee any benefit, at least you should guarantee कि कोई harm ना हो. And finally, जो principle use होता है वो है justice का. Justice is obviously अदालत जिसको बोलते हैं, अदल करना. This principle is very essential in various fields such as medical, political, social fields. The main concern of this principle is the distribution of scarce health resources. In medical ethics, the aim of this principle is to create fairness in the society regarding medical and clinical facilities. मतलब justice होना चाहिए ऐसा कि आपके पास महदूद resources हैं, महदूद रिसोर्सेज हैं और आपके पास बहुत सारे लोग हैं, मगर वो ट्रीटमेंट ऐसी है, अगर वो जरूरी है, वो सब तक पहुंचनी चाहिए. वो ऐसा नहीं होना चाहिए कि अमीरों तक ही पहुंचे, गरीबों तक ना पहुंचे, या कोई किस्म की एथनिसिटी तक ही पहुंचे, किसी और किस्म के कल्चर तक ना पहुंचे. जस्टिस का मतलब है, इफ देयर इज गोइंग टू बी मेडिकल क्योर फॉर अ वेरी हार्मफुल डिजीज, लेट्स से, it should reach everyone. It should be accessible to everyone. And if the resources are scarce, they're less, then we have to ensure equitable distribution. It should be an equitable distribution, a just distribution. चाहे गरीब है, ऐसा नहीं होना चाहिए गरीब है तो गरीब इंसान नहीं ये ट्रीटमेंट कर सकता है क्योंकि वो गरीब है सो वो मर जाएगा. वैसा नहीं होना चाहिए. तो जस्टिस देखना है. जैसे फॉर एग्जाम्पल आप कल को किसी फार्मास्यूटिकल इंडस्ट्री में काम करेंगे, या लेट्स से आप कोई थेरेपी डेवलप करेंगे फॉर सम सॉर्ट ऑफ अ साइकोलॉजिकल इलनेस, यू हैव टू कीप दिस इन माइंड दैट दिस इट शुड नॉट जस्ट बी लिमिटेड टू a specific group of people who will get benefited. Everybody should have the benefit. The best medicine is the medicine that is most accessible to everyone. So these four moral values help us to make rational and moral decisions. ये भी पढ़ेंगे. In medical ethics, the aim of this principle, which is the principle of justice, is to create fairness in the society regarding medical and clinical facilities. ठीक है, फेयरनेस इन द सोसाइटी. अब इन प्रिंसिपल से हम रैशनल और मॉरल डिसीजंस लेते हैं व्हेन इट कम्स टू दीज difficult problems, patient doctor relationships, surrogacy, euthanasia. We read on that. And uh, these are the principles that we'll use every time we discuss a problem. Okay? So now what I'll do is I'll end this meeting and I will send you another link and we'll study a bit more and then we're done. Then I'll let you know about the next class. Okay, so you can leave right now. I'll end this and I'll send you another link.